Good evening, everyone. My name is Meredith Toohey, and I'm the Conferences and Events Manager at the American Nutrition Association, the ANA. The ANA is very pleased to be hosting Dr. Deanna Minich tonight to discuss the association between skin disorders and gastrointestinal conditions. Dr. Deanna Minich is a functional medicine-trained clinician and researcher with a unique approach to clinical medicine which combines physiology and psychology. Dr. Minich holds a master's degree in human nutrition and dietetics from the University of Illinois at Chicago and a PhD in medical sciences from the University of Groningen in the Netherlands. She also holds the Certified Nutrition Specialist credential. Dr. Minich has had extensive teaching experience at the university level and serves as adjunct faculty at the University of Western States. She is both a board member and a fellow of the American College of Nutrition and a board member of Nutritional Therapy Association. Dr. Minich has over 10 years of experience working in both the food and dietary supplement industries and has authored 6 books on nutrition, wellness, and psychology, and is passionate in helping others to live well using therapeutic lifestyle changes. Welcome, Dr. Minich.
Hello, everyone. This is Dr. Deanna Minich, and I'm here to talk with you about one of my favorite topics, the gut-skin axis, and going through some clinical approaches to gut and skin health. And I often approach them in a very similar manner. So there is this interconnection between them. And I would say, just on a personal note, it's very interesting that I get to present on this. It's something that I've wanted to get into for personal reasons because my skin is so sensitive, and I've just had a past of acne and rosacea, and there's always something going on with my skin until I reached, I would say, my 30s and 40s, and I started learning much more about functional medicine, functional nutrition, and realizing that skin is really a deeper issue. We need to approach it systemically. So now I'm very harmonious and, working with my skin, and I'm grateful that I know what I now know, and I want to share that with you, bring in some of the latest science, and then talk about some clinical applications. And, skin is so important just even for our self-esteem. If we don't feel good in our skin, it's almost like, gosh, everything can really be thrown off. So I hope that this webinar will empower you with the information that you need personally and even professionally to give you that sense of confidence that you can approach clinical conditions with some basis from the literature using certain nutrients. Now, all that said, this is an educational webinar, and so nothing is to be used as giving you medical advice. So take that with some discretion. Look at these things within the context of, what you're able to do within your scope of practice. All right, so here we go. Our outline is the following. Moving through, first talking about skin and gut. I have a number of different slides just kind of waxing on the beauty and the philosophy of skin and gut together as a partnership. And then getting into key mechanisms, we'll then get into nutrients, which is really your area of focus. And then I'll tour you through 5 different conditions. We'll close then with a protocol for gut health, which is very much a staple for skin health. And so you'll see why as we start touring through all of this. So why skin and gut? Why do we put them together? Well, they actually do share a lot in common. They're very heavily vascularized, richly perfused. And so because they have some type of connection into the blood supply, they are connected to the rest of all the other systems in the body. So the brain, the heart, the kidneys, the liver. And so things fluxing through our system will be fluxing through our gut and our skin. The gut and the skin are also, in addition to being infused with blood supply, they're also very innervated. And so that's why when we get nervous, we may feel it in the gut, we may see it in the skin. And then the other thing that we think about with the gut especially is the gut microbiome. There's so much talk about the gut microbiome, but the skin also has its own microbiome. And the skin is intriguing because you can have different pHs, different types of skin, and you know this for yourself because you know your body. You know that the thickness of the skin on the palm of the hand is very different than the skin on the nose. So each of these places of the body are going to have their own pH, their own resilience, and their own colonies. So in essence, these are both complex immune and neuroendocrine organs. I don't see any separation amongst these different systems, and they're essential. Most people are looking at their skin and they're not thinking as much about their gut. So if we think of the cutaneous barrier, so let's look at the parallel right now between leaky gut. We hear a lot about leaky gut, but then there's also leaky skin. What can make our skin leaky? And I'm going to flip-flop and give you lots of different cartoons, graphics, and some studies talking about this leakiness, right? Because if we have a leaky barrier anywhere in the body, this is going to change its permeability and change its transport of nutrients, change its function. And that's what we care about within functional nutrition and functional medicine. So in the case of the skin, when I think of permeability, the reason why we don't want the skin to be so permeable is because we're going to lose water. We may have an influx of things that are toxic, whether it's chemicals, allergens, microbial organisms, or even if we think about heavy metals and just getting in through dust. The other aspect of the skin and the function and what else we have as part of that barrier is the nutrients that we take in. Many of the fat-soluble nutrients that we do take in embed right there into the epidermis, the fatty layer of the skin, to help protect it from things like UV light and to help to repair it from DNA damage, which can come from a host of different things, even radiation, flying. So the gut and the skin go hand in hand, and what you're going to observe is that most people with gut conditions typically have some kind of skin condition. In fact, I can remember listening to a speaker some years ago talking about how he had Crohn's disease, and he always knew that before a flare, he knew that the flare was going to happen because he'd get some kind of psoriatic skin outbreak. And so they tend to coincide together. About 1 in 4 people with celiac disease have a blister-like rash that they get, dermatitis herpetiformis. And in some cases, you don't even have to have celiac disease. You might have non-celiac gluten sensitivity, but still share some of this symptomatology with the skin. So the gut and the skin both are gateways to the nervous system. And the reason why the nervous system is so pivotal here in our discussion is because I'm going to start to bring in talk of stress. When the fetus is developing, there are a number of systems that are co-developing, and often we think of the skin developing side by side together with the nervous system. And so as a result of them coming together in utero, they tend to continue to collaborate throughout life. So that's just some basic setting of the stage and using some parallel language between the skin and the gut. If we look at the mechanisms of skin disease, first understanding the skin as the largest organ of the body. It is very similar to the gut in that it is separating us from the external world and giving us that barrier of protection. When I think of the skin, I think of protection. When I think of the gut, I also think of protection because it's a tube and it has everything on the outside coming in through that tube and selectively takes in anything that should be within our body. So let's just look at this graphic for a second. I think that this is really relevant for us understanding how we're going to proceed in this discussion around skin health and nutrition. The skin barrier unit it's almost like a number of layers of bricks. It's like a house, right? It's when you have your foundational layer and then you put another layer of the bricks and then you've got the mortar. So let's start at the top here because the top of the wall is the external interface. So what are we exposed to? Is it dry outside? Is it very humid? What about UV light, radiation? Did we come into contact with a plant that gave us a rash? So there's so much that's happening on the outside and so many inputs. And then similarly, let's look down and you can see systemic interactions. What's happening on the inside of the body that could be provoking and changing that flux going from bottom up? So here we might see changes in the blood supply because we're not exercising. So there's not a lot of oxygen moving through. There's not a lot of blood supply, so we could have buildup of toxins. When I think of some of the really very intriguing work on clinical detoxification, I think of Dr. Stephen Jennis's work, particularly the BUS study, blood, urine, and sweat, where he looked at how toxins come out through the body through these 3 different portals. And what he found was that the sweat released just about all toxins, and in many cases more effectively than the blood or the urine. So when I think of the bottom here, when I think of the system and the systemic interactions, there's so much that can be done on the inside to make for better skin. And that's why when people say, oh, what kind of lotion do you use? You know, the lotions, the potions, the creams, the personal care products, and slathering the skin with all of this on the outside. And I really feel like that is just one small fraction of skin health. I see it as the minor portion of skin health. I see that the major portion of skin health comes from within. And I always talk about that. Skin health means you start from within. And then, of course, all of those interlocking connections between all of the different cell types that are embedded within the skin. So the integrity of the skin is determined by those cross links. So collagen, vitamin C, even water, and mostly I think of fat. My PhD was on essential fatty acid absorption and metabolism. And one of the things I can tell you is that there is, every cell of the body has fat. And there is this lipid bilayer membrane that separates the inside of the cell from the outside of the cell. And so the integrity, just even of the cells within the skin tissue, are connected to the quality of the fat that we're taking in. So that's why we start thinking about things like omega-3s and looking at some of these anti-inflammatory fatty acids that funnel on into certain prostaglandins that help to reduce or quell inflammation. So in much the same way, the gut looks pretty similar. It has a layer. It's probably not as complex as the skin, where the skin has multiple layers, but yet you still have several enterocytes lining an individual villus. And inside the villus, you've got a blood supply, it's innervated. And so if there is a separation for some reason of the enterocytes, things can be let in. And then ultimately you can be affecting skin health just through the gut and what's getting into the systemic circulation. There is such a huge literature base now forming, looking at the connection between leaky gut and chronic disease. So some of the lifestyle-induced chronic diseases we're finding have this common thread of leaky gut, which tells me that there's a connection as well with skin. And so just about anybody that you're working with that has a gut condition, you want to be thinking about their skin and maybe even track it. You know, something as basic as constipation. So not defecating regularly. And what can happen is that there can be changes as a result of having constipation or even precipitating constipation, whether it's a change in gut microflora, greater intestinal hyperpermeability, immune changes. It's just one simple thing that we can be looking at for skin health. Because I know that just even in my own clinical experience, if somebody's constipated, they get all kinds of skin issues. You know, things don't get out of the body, so they have to get out some way. And typically the skin, being one of the largest reserves of being a portal to the outside, becomes that secondary line of defense when the bowel and when urine are not functioning properly. So there is quite a dramatic microbial influence on the skin, of course. We want a healthy skin ecosystem. I think that eventually we will have more and more sophisticated ways to assess the microbiome. I still feel like we are in the infancy of really understanding all the different colonies and what they represent. I think labs are really good at measuring different strains of microorganisms that are found in the gut, well, through the bowel, but what we don't fully understand yet is what all of those populations actually translate into. And the skin is even further behind. There's so much more we need to understand about the skin and how certain microbial influences can alter things like just even the local production of inflammatory cytokines. So this is where looking at even the external piece, where if we are able to modify the microbiome of the skin, we may be able to, at least in the first couple of layers, be able to modulate inflammatory response and perhaps some other features of the skin too. So when do we need to start thinking about the skin? Well, ideally, we want to be thinking about the skin even before we're born. And so we want to be looking at what is the mother eating? What is the maternal diet? We can even go back into the paternal diet, or even ancestrally be looking at some of the 3 generations and what this infant is bringing forth into the world epigenetically through transgenerational programming. But that's probably more complex than we can realize. I do think it's worthwhile to be looking at the means, the route of birth. So a vaginal birth is going to be very different for the skin than a C-section, of course, because you won't have the vaginal microflora to populate the skin, which, as it turns out, we're learning is a pretty big deal. So, and also just even looking at what babies are bathed in, what kinds of products are used by mothers on babies, and how that is very early on changing their skin microbiome. So the skin is so diverse. You know, it's really beautiful to think about the skin and how skin on the face is different than skin in the belly, on the belly area, or on the back. It's such a complex ecosystem, so it's very difficult to just treat it all the same way and say that that it's just one layer. It's very different, right? And so I do think that we're going to learn more about the skin ecosystem as we progress further. But for right now, we do have some very basic concepts from a nutrition standpoint that we can start to implement. Now, one of the things, by way of mentioning the nervous system in the skin, I do want to bring out a concept that I would say is more new even for me over the past couple of years. And that is that within the skin itself, we have functionally active membrane-bound receptors for 5-hydroxytryptophan. So in other words, our skin is receiving the message of serotonin, and it's a very psychoactively responsive tissue. And not only serotonin, and looking at serotonin and some of the precursors, but also if we're looking at the hypothalamus pituitary adrenal axis, the skin has much of the machinery that the brain is working with, all of the different peptides and signaling agents that come from the brain during the stress response are also expressed within the skin. So that's why when somebody is stressed, when there's a high amount of cortisol that's produced, what can typically happen is that you see over time skin breakdown. The skin becomes thin with greater somatic response. So it's kind of interesting to me that the skin is so responsive to stress. And perhaps it's not surprising in the way of just even personally me knowing about having a stressful event and then having a breakout or a rash happen or hives. I'm definitely no stranger to that, but to know that we have the machinery to create a stress response inside the skin, I think further emphasizes how important it is to get stress in check. or at least to support the body when we're under stress. And who isn't under stress? So psychological stress disrupts the skin's antimicrobial barrier and increases the severity of cutaneous infections. So when somebody is stressed, they tend to be more apt to have infections and lowered immune status. And as I mentioned, cortisol is what makes the skin barrier weak. You can get leaky skin. You can get this upregulated stress response and subsequent production of cortisol, and then all kinds of issues with leakiness of the skin. And you might also see itching. Itching is part of this whole stress skin inflammation response, and it could further perturb and exacerbate what's going on in the skin. So from a nutrition standpoint, what I think about here is histamine. Histamine is produced in the body. It's also in foods. And so if you have somebody who is very histamine sensitive, then they may be more prone to more itching. So again, not everybody has the same skin. We can't, it's so personalized. And so we just have to be asking people about their skin health like we might ask about bowel movements. So because the skin is so responsive to the nervous system, to the immune system, we have to be thinking about different interventions, lifestyle medicine-based interventions that can help with the behavior component. And that could be a lot of different things. I know for myself, one of my favorite things to do is just even to make sure I get more sleep. I will also go for massage. I will do acupuncture. I happen to be married to an acupuncturist, so that's very convenient. But we have to find what helps to reduce the stress response, or at least helps to modulate it, so that, and we can always tell from the skin how we're responding to it. Mindfulness-based stress reduction is also something to be looking at. It's been around for a really long time, came through the research of Jon Kabat-Zinn, and there have been a number of studies on MBSR. And in this particular case, I mean, there's so many different studies, and since we're focused on skin, I just thought I would share one of them with you, going all the way back to 1998, looking at how implementing a mindfulness meditation-based stress reduction intervention helped with skin clearing in patients with moderate to severe psoriasis. So this intervention, which was delivered by audio tape, very basic, it helped with promoting the resolution of psoriatic lesions. And now some of these were undergoing other treatments like light treatments, but they compared people who had the light treatments with the taped audio version versus the light treatment without the taped audio version. So they found that having that additional stress reduction audio helped significantly. So let's get into the terrain that most of you are very much interested in, and that is of nutrients for the skin. If we look at some of the common skin manifestations, this is where nutrition physical exam findings are so essential, because we can start looking at so many different things that are on the skin or in the skin and start to make some loose correlations that we can later follow up on with extensive history or laboratory testing through a physician. So keratosis pilaris, looking at vitamin A deficiency, might also be connected into reduced levels of zinc, or even vitamin E. Essential fatty acids is something I think about with keratosis of various types. Skin tags. Whenever I see skin tags, I start thinking about glucose and insulin and the balance between the two. Also, because of the insulin resistance, looking at increased cardiovascular risk. Acanthosis nigricans, this is where there's like a darkening of skin, typically at the base of the neck, is where, or around the neck in some region. There is a connection there with insulin resistance. Angular chelosis, so this is where you have dryness in the corners of the mouth. This may be connected to a microbial imbalance, so increased Candida albicans, or may also be connected to iron and or riboflavin deficiency. So, this is the tippy top of the iceberg of all the different things that can be manifest in skin and their connection with nutrition. There is so much, but these are some of the basics and some of the more well-researched basics. This is also for you a table of different micronutrients and skin health and what their function is. If we look at the vitamins to start, usually I'm thinking of the fat-soluble vitamins when I'm thinking of the skin. So fat-soluble vitamins are vitamins A, D, E, and K. And as you can see here, vitamin A, D, and E are mentioned. Vitamin A specifically, I think of for wound healing and helping to maintain the integrity of the skin barrier with production of healthy keratinocytes, so different types of skin cells, helping to repair the skin from any kind of damage, and has also been important for the prevention and treatment of psoriasis, ichthyosis, which is a dry, scaly skin condition, skin cancer, and acne. Let's just jump down to vitamin D. Vitamin D, because it acts like a hormone, is having all kinds of different effects in the body. So we're seeing improvements with the immune system with vitamin D. And if we're improving the immune system, we're helping the skin, aren't we? So we're going to be helping with inflammation and wound healing. And so from the bottom up, really helping with the integrity of the skin. And then E, to help with, as a fat-soluble vitamin that works very nicely with fatty acids, and so can help to offset some of the oxidative damage that can help with some of the fats that are in the skin cells themselves. When I think of vitamin C, I'm thinking about the obvious wound healing, but then also helping with the matrix of the skin, helping with the collagen formation and allowing for a better structure of skin to hold water better and to present better. There are so many minerals that are involved in the skin, but I do think that some of the top ones would be zinc, copper, and selenium, all of which in some way are helping to protect the skin. Like the skin is protecting us, these minerals are helping to protect the skin as well. So if we then look at what are some of the disorders of the skin and how do they connect into deficiencies of these different nutrients. So this is a short list of some things that you might want to be aware of. Again, the same vitamins and minerals that we just addressed, and looking at where these might be more important than in other types of conditions. So here's what I think of. This is like across the board what I think is important for most people if they just want healthy skin, no matter what condition they have. I think these things need to be considered. First and foremost, looking at sugar, because glycemic load and looking at the cortisol insulin response, of course, that that has a huge ripple effect. So just starting there, just not too long ago, I was working with somebody who, when I was asking them what they were eating, they had lots of alcohol, lots of processed foods, but yet they wanted to take a supplement for their acne. And I said, you know what, that's like a drop in the ocean compared to what you could be doing by bringing in better information through your diet. Then looking at food allergens, because if we're constantly eating foods that are keeping us in a state of inflammation, that's going to impact our skin. So looking at food allergens is important, especially for eczema and psoriasis. We need to be focused on protein digestion. So there might be a connection there with psoriasis. Balancing dietary acid alkaline with rosacea, and that's just basically making sure that we have proper amounts of potassium and some of the high mineral foods like plants versus some of the things that are more acidic. So amino acids, fatty acids. So bringing together the acid alkaline balance a bit. For herpes simplex outbreaks, looking at the ratio of arginine to lysine, And then ensuring sufficient antioxidant intake. I think in general, these are things to be considering. And as you can see, most of it involves the gut. It involves what nutrients we're taking in, but then also how we're processing those nutrients. Now, when it comes to essential fatty acids, I do think because every cell in our skin has that lipid bilayer membrane, we need to be sensitive as to what we're putting in with respect to fat. So flaxseed oil might be good because of its alpha-linolenic acid content. That's an omega-3 fat, which later converts on into some of the longer chain anti-inflammatory fats like EPA and DHA. So what we see with flaxseed oil supplementation, decreases in sensitivity, decreases in water loss, or skin roughness and scaling, and smoothness and hydration are increased. If we look at GLA from evening primrose oil, or whether it's coming from black currant seed, borage seed, hemp seed, keep in mind that there are different types of fatty acids that funnel into different prostaglandins. And GLA goes into the series 1 anti-inflammatory prostaglandins. So many people think that all omega-6 are inflammatory, but they're not. The GLA and DGLA are very important for promoting healthy skin by making more of the anti-inflammatory prostaglandins. Higher levels of omega-3 fatty acids decrease inflammatory factors and may reduce acne by decreasing insulin growth factor 1 levels. IGF-1 levels are thought to be implicated in acne. So it's a growth factor. It's connected to insulin, and insulin propels growth. And so it's thought that this leads to some skin manifestations with respect to inflammation. Oral vitamin D rapidly attenuates inflammation from sunburn. And I thought that this is really interesting, coming from a history of many sunburns when I was a teenager and a child. You might have had this exposure yourself. But what this study was looking at was giving people very, very high amounts. Now, these are just way too high. These are therapeutic amounts that were administered by way of this study. So 200,000 IUs. They gave this amount of vitamin D3 to people who had had sunburn and found that they were able to reduce the amount of inflammatory mediators compared to people who did not receive the vitamin D. Vitamin D levels are also lower in those with acne. You know, in general, vitamin D is low in everybody, is what I have found. It's very rare, unless somebody is supplementing and they're supplementing on a consistent basis, to have pretty stable levels of vitamin D. So as you can see here in this case control study, that there was a deficiency in 25-hydroxy vitamin D in almost 49% of people with acne, but only 22.5% of the healthy controls. So vitamin D, it's not saying that having low vitamin D is causing acne, but there might be an association here. And there surely could be a connection with inflammation. Let's see. And also in a subsequent trial, improvement in inflammatory lesions was noted after supplementation in people with acne. So there could be a benefit there. The other nutrient that I like very much for skin, and we hear a lot about this, is zinc. Zinc is so important, and I more or less put this together with vitamin A. They work very hand in hand. And both of them together are essential for wound healing and tissue repair, as well as immune function and even induction of a protein that binds to heavy metals and minerals in the body. So zinc is important for mineral metabolism, which is important for the skin, and also involved in the metabolism of heavy metals out of the body. So really important. Most people are deficient in zinc. Now, the only thing with zinc that I think of is that you don't want too much zinc either, because you could perturb or create types of dermatitises by having too much zinc. So the tolerable upper level of zinc is 40 milligrams per day, according to the Institute of Medicine. Antioxidants, yes, lots of different ones, of course. If we're looking at vitamins, I would be thinking of A, C, and E. Selenium, it tends to be decreased in acne vulgaris and psoriasis, although you don't want to go too high in selenium either. You know, even though this could look like, wow, so many things to do, so many nutrients to take, if you take too many of certain ones, you can also perturb the skin. So there has to be a good balance and not overdoing levels. And that's where I start to see, well, often when people are supplementing, they're going to be more prone to overdoing things like selenium. So with selenium, I think of the tolerable upper level as 400 micrograms. And then glutathione support. So many people have genetic variants. They have SNPs in the enzymes that make glutathione in the body. And glutathione is an important antioxidant. It's also really important for detoxification. So decreased levels have been observed in people with a whole host of different skin conditions. So that's not always something that people make a direct connection to, but it is really important. And glutathione support could be anything from vitamin C, vitamin E, selenium, whey protein, glucosinolates from cruciferous vegetables are just a number of the different nutrients to support healthy glutathione in the body. So I'm going to show you a series of different cartoons here that I think are really well done. This is looking at some of how the different nutrients interplay with the cellular dynamics of skin. And so if we start at the top here, we're looking at vitamin A. And vitamin A can come from beta-carotene, which can convert into the active retinoic acid, or it can be taken in through vitamin A directly as retinol. And so the connection between retinoic acid and the receptors inside certain cell types can lead to changes in transcription for DNA damage, helping with DNA repair. It can help with accelerating wound healing and help with damage from UV radiation. And so, retinoic acid has been such a common active and compound, at least even topically, when we see skin health products. Vitamin A, on the other hand, can also have a high degree of toxicity. So we need to remember that. There have been some studies in the past with high amounts of vitamin A taken over time and increased risk for things like fractures. So oftentimes what I like is to choose the precursor to vitamin A, beta-carotene, and then to allow the body to convert into how much retinoic acid it needs. Now, the only thing with that is that not everybody is an efficient converter. So for some people with thyroid conditions, they might have an issue with converting beta-carotene into retinoic acid. But in general, that's usually my preference, especially if somebody is supplementing. It just kind of depends on the person, of course. So here's an example of where you have UV radiation coming in, and what tends to happen is now you get increased of these reactive oxygen species in the skin. So you get these very reactive particles that do damage. And this damage can ultimately lead to skin cancer and changes in skin integrity and breakdown of collagen, which is why for people who have had repeat sunburns, they start to have increased aging of the skin. And so vitamin C can be helpful for that, as well as some of the other antioxidants. Same thing here with vitamin D in a different way, can work on different mechanisms, but yet be very supportive of the skin. So we need a little bit of UV to convert the vitamin D, the provitamin D3 in our skin to the pre-vitamin D3, and then to move on into the 1,25-dihydroxy vitamin D3. And then that leads to all of the different things that vitamin D can do for us and how it can benefit the skin as well. In this particular scenario, now we look at vitamin E. And so vitamin C is really great at helping with the production of certain reactive oxygen species. Vitamin E is almost like a correlate to vitamin C in the way of helping with reducing the lipid peroxides that form. Because vitamin E is fat soluble, it's going to be more important for the lipid peroxides that form within the skin. So any kind of skin inflammation or breakdown because of the reactive oxygen species, vitamin E can be helpful for reducing those processes. And then, when I think about plants, we're talking about all of these vitamins and minerals, but even just plants, how plants can change the intestinal microbiome, which can then eventually change how the system is responding to certain metabolites, which can ultimately change skin health. And so, and there are even studies showing that when people eat more plant-based foods high in carotenoids, that they can change their skin color slightly, because actually what you're doing is you're embedding into the epidermis these carotenoids, which are a bit pigmented. So either directly they can influence the skin, or indirectly, as is shown here, through the influence of these plants on the gut microbiome. So let's go through each of the conditions briefly, and what, I talked very generally about the gut and the skin, got into some of the nutrients that are just in general good for the skin. But now let's look a little bit more specifically at acne vulgaris. Acne is one of the most common dermatologic conditions, and typically we think about it being related to excess oil production and inflammation that could be causing that, or just even connected into hyperproliferation of certain bacteria. Milk can increase the level of IGF-1. There's some initial research on that, which can lead to the synthesis of androgen-mediated increases in sebum. There is a little bit of science on chocolate predisposing to hyperglycemia, and by working on increased glycemic load, aggravate potentially acne vulgaris. High levels of omega-6 fatty acids in the standard American diet, or just the standard processed diet, have also been associated with an increase of acne, in contrast to omega-3s, which help to reduce inflammation. So immediately I would be thinking about getting fatty acids back into balance, getting more omega-3s and less omega-6s. This is a study looking at dietary glycemic load and acne. Relatively small study, 64 people. They had a group with no acne, and then they had another group with moderate or severe acne. And what they found that was different between the two groups is that people with moderate to severe acne consume greater total carbohydrate compared to people without acne. And they also had greater insulin and insulin-like growth factor 1. So this is why glucose-insulin balance is so important when it comes to acne. So what I think about is reducing or eliminating food triggers, especially milk. And even if somebody's not technically allergic, I would still refrain from milk. I would take out chocolate just to see if those are trigger foods. And I would be working on glucose-insulin balance through a low glycemic load diet and helping with supplemental nutrients if needed. Because you don't want to have those androgens increased, right? Because they can lead to inflammation. And then thinking about these folks in replenishing their omega-3 levels to help with inflammation. What about rosacea? Rosacea is, typically when I think of rosacea, I think of an adult type of acne, whereas acne vulgaris I think of as more of a teenage form, but they can overlap and occur at any age, really. But rosacea typically occurs in light-skinned Caucasians, in people between 30 and 50. And it usually affects the center of the face, the cheeks, the nose, chin, central forehead. Sometimes it can even express through the eyes, like the eye membrane can get red and flushed and irritated and itchy. And what happens is that there are these flushing episodes which can occur based on emotions, like a bout of anger or fear, or maybe it's being outside in the wind or eating certain foods. So many things can, again, if the skin is this neuroactive tissue, just about anything can stimulate it. There are a lot of different mechanisms thought to be at play here. So some idea that mites might be in the skin, or that there's a change in microbial colonization of the skin. Maybe there's gastrointestinal imbalance. This is the one that I tend to go to, that there's some kind of GI imbalance, whether it's stomach-related, dyspepsia, bloating. Oftentimes I will be looking at how people with rosacea digest protein. So having that bloating after a meal, 30 to 60 minutes after a meal, could signify protein maldigestion. And then those maldigested proteins move on into the intestine and are putrefied. And then you get all these byproducts that can be absorbed back into the system and cause this skin outbreak. So what I think here of with rosacea is, of course, to be looking at an elimination diet. If there are additional nutrients that are needed, perhaps zinc, but again, to pay attention to the fact that zinc can be toxic above 40 milligrams per day. So with people taking multiple supplements, I'm always thinking about that. But in this particular study, they did find in 25 people with rosacea, they gave them zinc sulfate, and they found it was a good option in the treatment of rosacea, as it was safe, effective, and lacking important side effects. I would be, and so just a second, I lost my slide. Okay, oops, something just happened. Resume slideshow. Oh, there we go. All right, so I would be thinking of herbal antimicrobials, probiotics, zinc. We'll get into this a little bit more when we go through the gut health program towards the end. But really doing an overhaul on the gut and looking at triggers, especially food, and what can be done topically here too. I know that dermatologists do prescribe certain topical antibiotics, but I think that there's a lot that can be done nutritionally working on the gut. Eczema. Eczema is it's itchy. It's very uncomfortable. It is not typically, for everybody, there could be a different etiology. And oftentimes you see it in children, but it can also occur in adults. So what does it look like? It's dry patches of itchy skin. They can be severe, especially at night. They can be on the hands. It could really be anywhere. And what makes it uncomfortable is because it is so dry and itchy that if you scratch it, it just kind of perturbs the whole process. And so then people get the swollen, raw, sensitive skin. We know that eczema is a dysfunctional skin barrier type of condition. And anytime you have dry, flaky, irritated skin, there's something going on in the epidermis, right? And so especially with eczema, needing to look at barrier dysfunction and looking at all other types of mucous membranes, which may also be responding to this imbalance. So what I think of here is to identify food allergens, really important, I think, for across the board for all types of skin conditions. And then to be looking at potentially repopulating the gut with some source of probiotics and prebiotics to keep those probiotics living. And so that can be done through fermented foods. It might be done through a probiotic supplement. Either way, I tend to prefer working with food. Then reducing topical chemical exposure, looking at maybe what the source of the trigger is. Zinc for wound healing if there's low zinc. Vitamin D. There was a study looking at how, it was actually a meta-analysis where they look at many studies together and then looking at patterns. And they found that serum vitamin D level was lower in people with atopic dermatitis, and that vitamin D supplementation might be helpful for these folks. DHA, one of the long-chain omega-3 fats, and even an air filter to reduce particulates, to reduce the amount of insult and toxic burden that we have just from everyday living. Psoriasis. Psoriasis is along very similar lines to eczema. I would say it's, in some ways, it can be more complicated and more, I have seen a number of people with psoriasis, and it just shows up in a variety of different ways. Whether, again, scaliness, so there's an obvious issue with barrier function, and so it is an inflammatory condition. Traditionally, it's been regarded as a disease affecting only the skin and the joints, and it's been associated with an increased risk of developing severe vascular events such as myocardial infarction and stroke. So any of these skin conditions, I want you to be thinking broader into insulin resistance and cardiovascular disease risk, for sure. These folks have been documented to malabsorb their nutrients. So this was a small study, 55 psoriatic patients, 65 healthy controls, and seeing greater malabsorption in the psoriatic patients, 60% greater malabsorption versus controls at 3%. And then when you look at malabsorption in other groups, celiac disease, 6%, bacterial overgrowth, 21%, parasitic infections, 3%, and eosinophilic gastroenteritis in the psoriatic group, that there are co-conditions existing together with the psoriasis. So just to clarify, it's not malabsorption in each of these conditions, it's that psoriasis can coexist with each of these to varying levels. So gluten-free diet might be one thing to try here. Again, I always think of an elimination diet to start, even more than just gluten. A large body of evidence suggests that psoriatic patients, either with concomitant celiac disease or asymptomatic gluten intolerance, may benefit. Psoriatic patients who tested positive for anti-gliadin antibodies and who followed a 3-month gluten-free diet resulted in a significant decrease in the affected area of the skin. So it's definitely one thing to try, and it may not hurt, right? It just kind of depends what the gluten is being substituted with, however. So I'm just going to show you a couple of different images from an article in which they were looking at different dietary triggers that worsened psoriasis. And what we have here is, so the greater the bar that goes over to the right, the greater that trigger in worsening psoriasis. Sugar up at the top, so alcohol, tomato, gluten, and dairy are all part of that. And then in terms of improving psoriasis, certain supplements were important: vegetables, fruits, water, and fish, which absolutely makes sense to me because of the different nutrients that they contain. So this is also really interesting. So they were looking here at, on the left, what people would remove from their diet, and then who had clearance or improvement of psoriasis. So you can see the percentages listed there. And then on the right, dietary additions. So what percentage of people reported full clearance or improvement of psoriasis after addition? So it's basically what I just spoke to. So when it comes to removing certain things, it looks like it's important to be looking at alcohol, gluten, nightshades. This is one place where nightshades may be relevant for people, is looking at people with psoriasis. Junk food, which is defined as candy, pastries, chocolate, French fries, potato chips, and sweets. White flour products, dairy, shellfish, high fat, caffeine, pork, tobacco, red meat, and sodium. Whereas additions would be fish oil, vegetables, and oral vitamin D, probiotics, organic foods, and fruits. So this is, again, specific to psoriasis. And then looking here at special diets and what are some of the diets that people respond best to. So you can see here, gluten-free tends to be towards the top of the list here. A vegan diet, Paleolithic is equal to that, just about. So, I just think cleaning up one's diet in general will be helpful. But then there are also other lifestyle measures, like I had mentioned tobacco. And if you look at the literature on smoking and psoriasis, there was a meta-analysis showing that there was a significant association between smoking and psoriasis. And so how do we help people to start moving away from unhealthy behaviors, right? So focusing on the 5R gut health support, elimination diet, and smoking cessation, and any kind of work that we can do across these different conditions to help with stress. And then finally, aging skin. There are many different pathways here to aging skin. And it could be any number of things: sun, smoking, air pollution, things that are on the outside. But it can also be things on the inside. So maybe we're not eating so well. We're not feeding our skin with proper nutrients or even hydration. So what are some factors connected to cellular aging? Well, inflammation, cortisol, oxidative stress, UV exposure. And over time, this gets compounded. So again, I'm going to bring you back to what I was talking about before with carotenoids and how useful they are to protect against the sun. Long-term supplementation for 12 weeks with 24 milligrams per day of a carotenoid mix, supplying similar amounts of beta-carotene, lutein, and lycopene, help with reducing the redness that came from exposure to UV. So that's why, even me personally, I start my carotenoid supplementation. I actually just started in March to prepare for the summer months. And I know that my skin just feels better, looks better when I have sufficient carotenoids, when I can blunt some of the damage from any exposure to UV, even if I'm wearing sunscreen. Dietary nutrient intakes seem to be correlated with skin aging appearance. So higher intakes of vitamin C and linoleic acid and lower intakes of fat and carbohydrate are associated with better skin aging appearance. And water. What about just water? It's so important to be drinking fluids. You will see a difference in hydration and how the skin is smooth. And again, it can deliver nutrients. Through the water, it can facilitate that delivery better and also can remove toxins better. So plants, I'm going to leave you with this because plants are so important for helping with all of these skin conditions. And I do think that not just the vitamins and minerals, but the phytonutrients are going to be important for us as well. And so many people are not eating the rainbow. If you know anything about my work, I'm always talking about eating the rainbow and how important it is. And so how do we leverage eating these colors and maximizing them in food? Well, we can do that with a little bit of heat, so a little bit of steaming. They don't necessarily have to be taken in raw. So steaming and applying heat can help to liberate some of these fat-soluble antioxidants, these carotenoids. So red foods, just as a prompt to remember all of the the different types of red foods that are out there. And of course, avoiding nightshades, the red foods that are nightshades, if there's even a hint of potential inflammation. Orange foods, lots of different varieties out there. Turmeric to help with inflammation, but also a lot of the enriched beta-carotene, beta-cryptoxanthin, a lot of the different carotenoid-containing foods. Yellow foods, too. Some of them are, I think of lemon, I think of ginger to help with reducing inflammation. Green foods, there's no shortage of green foods, right? And we know that a lot of these green foods can be important for helping with proper detoxification. And blue-purple foods, those proanthocyanidins that make food blue-purple are important for certain parts of the brain. And if we're helping the brain, we're helping the gut. If we're helping the gut, we're helping the skin. You see how it's all connected? And it's all connected through these colors. and even some of the white foods too. And so you've got here sauerkraut, white tea. There's also some research on white tea. I think tea in general is wonderful, but certain teas do certain different things. And so to be sure that you get some variety. So in close, I think probably most of you are familiar with a general gut protocol. This will be a very simple way to contextualize it. We think of it, no matter what discipline we come from, we have this mantra burned into us, right? This idea of always starting with the gut. And so when I think of a 5R functional medicine-based approach to gut healing, I think of these 5 steps, and I'll take you through them quickly. First and foremost, removing whatever's getting in the way. What is the trigger? Is there a food intolerance? So starting with something like an elimination diet, which I do all the time. It's so important to do an elimination diet. And also to bring in things that might be helpful in removing pathogens. And that might need to be done with the help of a physician or somebody who can prescribe something stronger in order to overcome some of the colonization of unfavorable microorganisms in the gut. So elimination diet, keeping it really basic, taking out the 8 top allergens, making sure that you take out gluten to see whether or not that's creating an issue. And when somebody first starts an elimination diet, typically there's an issue with bowel habits, and the bowel is not moving as quickly, and there's more constipation because there's been a dietary change. And so getting more fluid, making sure that there's fiber, and also looking at any kind of medications that can be at the root of perturbing healthy bowel movements. Secondly is replacing. And so as we get older or as we get stressed, we tend to reduce the amount of secretions that we have and need in the gut. So things to help us break down protein or carbohydrate or fat. And so bringing some of those in through food, like bitter foods that can stimulate the parietal cells to produce more hydrochloric acid, or even dietary supplements to bring in exogenous enzymes to help break down food. It's so important to get stomach acid right, because if we don't have stomach acid in its proper context, what can happen is a lot of different things, and all of these things can lead to poor skin. So poor protein digestion, increased food allergenicity, can't absorb certain vitamins and minerals very well, and then microbial overgrowth. So stomach acid is really important to get right. And in some cases, betaine HCl needs to be given as a supplement in order to help stomach acid be in proper amounts. And there are specific functional medicine protocols for this. So don't do this without being informed and knowing how to do this, because you can actually do damage giving somebody hydrochloric acid in ways that are contraindicated. Inadequate stomach acid can lead to impaired digestion of B12, magnesium, and iron, and also not breaking down protein. If you don't have protein, how do you build the skin, right? Protein is the other component of the skin in addition to fats. So there can be lots of different modalities here. And again, I want to be sure that you know what you're doing before you would even implement something like this. There are some great resources like the textbook of functional medicine has a protocol in the back. There's also another great book by Dr. Gilliam's, Functional Strategies for the Management of Gastrointestinal Disorders. Number 3 is to be looking at how to reinoculate the gut with good bacteria. That can be done, again, I prefer through food, but it can also be done with different probiotics. And probiotics we know how important they are for a number of different things within the gut. And their presence in the gut can change the immune system, can change mood, can change so many different things. And if we're stressed, what tends to happen is we cause changes in the gut microbiome. So having probiotics as a safeguard can be helpful. There have been some studies on skin health and probiotics. So this particular study was looking over a 12-week period They gave them a certain probiotic, and essentially they were looking at people with acne, and they found that supplementation with this bacterium helped to normalize skin expression of genes implicated in insulin signaling and even improve their acne. Here's another study in which they were looking at Lactobacillus paracasei, NCC2461, a certain strain, and finding that this probiotic had helped with skin barrier function. So typically when I think of probiotics, again, number one, food first. Look at the studies on the specific strains. Sometimes if it's just for general health, looking at multi-strain, having that diversity is important, which is why a varied diet is so essential. And I do think that having rotation and having different microorganisms and not getting too stuck in any one strain could be helpful. And of course, any kind of fibers to support the longevity, the viability of those probiotics. The fourth step is regeneration, helping the gut to renew itself and get a new lining with different actives, different nutrients. So glutamine, licorice, aloe to soothe the gut, having fiber as a prebiotic to change the pH and to help with a lot of the production of these secondary metabolites like short-chain fatty acids that help control things like insulin, glucose, and even satiety. And then some anti-inflammatories, some building protein, and healthy fatty acids to help build up the lining of the gut. And then finally, probably the most difficult one is to rebalance. And so looking at stress reduction here, getting proper movement. You know, for some people, maybe they're constipated because they're not moving. There's no activity. So nothing is moving inside of them. So this is really just getting into balance with one's life and how important that is for the gut and ultimately for the skin too. So in general, if we were just to summarize skin support at the core, maintaining good gut health through the 5-hour program, keeping a check on stress, making sure that the diet, the way of eating is low in glycemic load and index, as well as being devoid of any potential allergenic triggers and being full of protective plant-based phytonutrients, right? So things like the carotenoids that we talked about. Supplementing with omega-3 fatty acids according to lab values and repleting with other nutrients depending on need. And then as an ongoing process, keeping the immune system in check, making sure elimination is adequate, maybe doing some seasonal detoxification practices, some sweating, drinking adequate fluids, all really essential. So on that note, I want to thank you for being with me and getting excited about the gut and the skin. It's really so essential to our health. So think of your takeaways from here on out, and hopefully this information will be helping you and your clients. Thanks so much.
Thank you, Dr. Minich. Unfortunately, our time is up. This has been an enlightening evening, and we invite our audience to learn more about your work at deannaminich.com. Good night and best of health to you all.